Hello everyone, welcome to another episode of Psych Talk. Today I will be diving into Obsessive-Compulsive Disorder, commonly known as OCD. Interestingly enough, OCD affects an estimated 3.3 million people in the US alone, ranking it among the top 10 leading causes of disability in industrialized nations. It's a condition that combines both obsessions, such as recurrent intrusive thoughts, images, or impulses, and compulsions, which are repetitive actions or mental acts that a person feels driven to perform to reduce anxiety or prevent something they fear. I will give you an example. So, imagine someone who has this persistent intrusive fear that their hands are contaminated with quote unquote harmful germs, which could cause illness for themselves or others. This fear of having a lot of germs in their hands, it's an obsession, which brings an intense anxiety and also distress. And to manage this anxiety and this overwhelming feeling, they may develop a compulsion, which is to wash their hands repeatedly over and over with extremely hot water and a lot of soap. And they might end up washing their hands dozens or even hundreds of times a day, spending hours in a ritualistic kind of routine, which can result obviously in very dry or damaged hands and damaged skin. And despite knowing that their hands are clean, or even feeling embarrassed by the amount of washing, they find it almost impossible to stop, as the compulsion provides a temporary relief from their anxiety. And this cycle of obsession, which is the fear of germs, and compulsion, which is the excessive hand washing, is the feature of OCD, or this is basically what OCD is. So the experience of OCD can vary. So obviously sometimes, some people may have OCD about feeling like they have a lot of germs on their hands, or some people have OCD about the fact that they think that the door is not closed and they keep checking that they lock the door. Or they may have OCD about, it can be about anything. I have a fun example. There is this client that basically, one of my professors had this client that basically, he had OCD about basically masturbation. So he will masturbate over more than 5 hours a day, 6 hours a day. And basically, his obsession was having the perfect quote unquote orgasm. And so he will masturbate as a compulsion, and he had to have the perfect ejaculation, if that makes sense, or orgasm. Otherwise, he will have anxiety about it. And so I thought that was very interesting. I didn't even know there was such a thing as having different type of orgasms in men. I don't know. Anyway, basically, my point is that OCD can vary very widely. But in general, it disrupts daily life, from social interactions to work responsibilities. And many people with OCD are actually aware that their thoughts and actions might be unreasonable or excessive, which it adds another level or layer of distress. But they find themselves unable to control them. And OCD, hoarding behavior, is diagnosed with different levels of insight, from good or fair insight, where the person understands the irrationality of their thoughts, to poor insight, where a person may not recognize this. There's also an absent insight category for those who believe their obsessive thoughts and actions are entirely valid. And also, some individuals with OCD may experience tics, which can further complicate their symptoms. And as I said before, obsessions and compulsions are specific to each person, so it can look very different from a person to another, but often involve themes that provoke considerable anxiety. And for instance, some people may experience what's known as magical thinking, believing that just having a thought could make it come true. And children might fear harm coming to their parents because of a thought they had, and that thought itself becomes obviously terrifying. And to cope, people with OCD may develop rituals or compulsions, such as repeatedly checking things or cleaning obsessively to feel a sense of control or to reduce their anxiety. An example could be, let's say, a child is scared that if he does not jump like 20 times, his parents are gonna die. That could be an example. So he's gonna jump like 20 times, maybe for like, I don't know, maybe every 30 minutes, or maybe he's gonna jump 100 times for like, every 30 minutes, or maybe he could jump 5 hours straight because he's scared his parents are gonna die. And so let's walk through some of the common obsessive and compulsive symptoms. So, for example, obsessive thoughts or phrases can disrupt normal thinking and often appearing as obscene or nonsensical words. Then we have disturbing images, so violent or inappropriate images that create distress. Then we have ruminations and repeated behaviors, like constantly checking if doors are locked or appliances are off. Impulses to act in potentially harmful or humiliating ways, thoughts of aggression, self-harm, or extreme embarrassment, and fears of contamination or specific situations. For example, it could include anxiety about germs or fear of public bathrooms. And people with OCD often find themselves in a cycle of distress where these thoughts lead to compulsive rituals to alleviate the discomfort. For instance, let's say there is a woman with the obsession that she might drop her cat in the fridge, will compulsively empty the fridge repeatedly to ensure her cat is not inside. And OCD tends to emerge gradually and often during one's late teens or early 20s. It affects many women, but can appear earlier in males, sometimes as young as age 2. And there is not one clear cause of OCD. Research suggests that there is like a mix of genetic factors, brain chemistry, and environmental influences, such as past trauma or stress. And studies on identical twins indicate a strong genetic component, and brain imaging research points to abnormal activity in areas like the orbitofrontal cortex and serotonin imbalance. And people with OCD often face additional mental health challenges, anxiety, mood disorders, and even body dysmorphic disorder frequently co-occur. And for children with OCD, the presence of tics or conditions like ADHD or separation anxiety may complicate the diagnosis. OCD can be very challenging, but obviously treatment can bring significant relief. And the most effective approach is typically exposure and response prevention, which is basically a behavior therapy where clients gradually face their fears without performing their usual rituals. And this helps retrain the brain to respond differently to these obsessive thoughts. And so individuals are gradually and intentionally exposed to situations or thoughts that trigger their obsessions, but they're encouraged to resist engaging in their usual compulsive response. And by doing so, they learn to tolerate discomfort or anxiety caused by these obsessive thoughts without relying on compulsions to alleviate it. Because that's why people act or like they engage in compulsions, is to alleviate the anxiety that these obsessive thoughts are causing. And so over time, this practice helps break the cycle of obsessions and compulsions, and the brain begins to adapt by rewiring itself as it learns that the distress associated with obsessive thoughts can decrease on its own without the need for the compulsive behaviors. And what essentially ERP helps is reducing the brain's learned association between obsessive thoughts and the need for a compulsive response, which decreases the intensity and the frequency of these urges. And this process is also supported by, obviously, neuroplasticity, which is the brain's ability to form new neural connections, which allows individuals to develop healthier responses to obsessive thoughts and ultimately reducing or getting, quote unquote, rid of OCD. And by the way, I probably did not mention this, but OCD, you can be diagnosed with OCD even if you have only the obsessions without these obsessions being followed by compulsions. So you may be diagnosed with OCD if you have either both. So the DSM says that you can even have both obsessions and compulsions or just obsessions. And that is it for this episode. I hope you liked it.